my name's Ashley, and I'm going to be talking to you about medication administration. So, this presentation kind of acts as a partner to the medication management presentation you're going to have. And in this one, I'm going to talk to you about different types and forms of medications you might have to give at some point. Not every kind of medication is covered in here, but we try to think about what could be the most common types of medications and try to include that in here for you. I'm also going to be talking to you about different tips and tricks for administering some of these medication types, and then some sort of general safety considerations. Like I said, not everything's covered in here. So if there is something that you have questions about, please feel free to reach out to us. We have some resources available for you too that could be helpful, but please just don't hesitate to ask if you have any questions. So I'm going to start with oral medications, and the first one I'm going to talk about is tablets. So we want to make sure that we don't crush or chew tablets unless their directions are saying it's okay to do that, or the pharmacist or provider told us it's okay. Um, because a lot of these tablets, they have a coating on them that helps it make sure that they are dissolved and absorbed in the person's system over a long period of time. So if we crush it or chew it and it wasn't meant to be that way, then basically someone's getting that whole dose in their system at one time. And that can be a big safety concern if it's something like a blood pressure pill. It could actually lower their blood pressure if they get too much that dose all at one time. So making sure that unless it's in the directions or the pharmacist or provider said it's okay to do that, that we avoid crushing or chewing any tablets. Um, of course, if you do crush it, then you want to make sure you're trying to mix it with something that the person enjoys. So something soft like ice cream or pudding or applesauce, yogurt, any of those work. Just something that they like to eat that's soft that they can swallow it with, so that it tastes a little bit better, because it is pretty bitter when we have to crush pills. It really doesn't taste very good. So if we just try and mix it with something that they enjoy, that's really helpful. And then this line here means that the pill is scored. So unless tablets are scored, we want to avoid trying to cut them in half, because otherwise this is what is meant to help it, so that if you cut it in half, that you're being more precise. It's going to cut in half easier, and then you're actually getting half of that dose, like you're intending to. And you want to make sure that you also use a pill cutter when you do this. So not trying to pop it in half, or use a knife or something. You want to try and use a pill cutter, so you can be very precise. And then also, if you notice that you keep having to cut pills in half, it's certainly worth asking the provider if they might be able to order you a smaller dose, so you don't have to keep doing that. Sometimes there's really not much they can do about it, and that's just the smallest dose that the manufacturer makes. But sometimes they can order you a smaller dose, and then that saves you a lot of trouble, and it's much easier and just nicer if you don't have to keep cutting it up every time. So if you do notice that, just ask the provider and see if they can give you a smaller dose. So sublingual tablets, so you might see these in a day-to-day kind of scenario, but more often I think it would be something you might notice in hospice. So these are very easy. I just wanted to mention them just in case. All you have to do is put them under a person's tongue and it will dissolve. So no one has to swallow, swallow or chew these. You don't crush them up. You just put them under the person's tongue, and then it can just dissolve there, and that's all you have to do with it. But I just wanted to mention that in case you see that. So gel caps, capsules, caplets, these, like the tablets, they're made this way on purpose, and so you have to make sure that you're taking them whole, your loved one's taking them whole, which sometimes that's hard to do because some of them are pretty big, and it can be kind of hard to swallow them. So if you're noticing that your loved one's having trouble swallowing these, then just ask the pharmacist if they can give you a different form, if they can maybe do a liquid form. So that can make it a lot easier for someone to swallow. And then of course let the provider know too. But these have to be swallowed whole. So if your loved one's having trouble, just ask for the liquid form. And there's a lot of things that they make. They have that alternative liquid form for now. And then of course, if you do have the liquid, the syrup form, then we want to make sure that we're being very precise when we do the dosing for this. So we want to have a dosing cup or a syringe or a dropper something to help us make sure that we're being very accurate and precise with this, because it's a lot like baking. We have to be really careful how much of a dose the person's getting, how much liquids there, because otherwise that can make a big difference in the dosing that they're getting. It's not very much liquid, but it can be a big difference in what dose they have. So skin medications. So there's different creams and ointments, and the thing to remember with this is that unless it's actually intended to be used on a wound or some kind of broken skin, we want to avoid that, because that would certainly affect the way the medication's absorbed. And then when we're putting these creams and ointments on our left, we want to make sure that we're wearing gloves, especially if you're really going to be rubbing it into the person's skin. It's a good idea to wear some gloves and maybe even double gloves, because they do have little micro holes in them. And so if it's something that you're really going to be rubbing in, you can even consider wearing the two pairs of gloves, just to make sure it doesn't get absorbed into your skin too. So patches, the things to remember here is that we don't want to apply this to any broken skin or any wounds. We want to avoid those areas. We also want to avoid putting these on top of, if someone has a internal defibrillator or a pacemaker, we want to avoid putting a patch over that, because if that pacemaker or defibrillator gives a shock to a person, then it can interact with the patch and it can be a big safety concern. So we want to avoid that. When we do put them on, we want to try and look for a dry, flat, hairless area. So usually the upper chest can be a good place, unless they have the pacemaker defibrillator. The upper arms can be a good place, the shoulder blade. Those are usually good, dry, flat, hairless areas that we can put a patch on. And then when we do put one on, we want to look for the old one before we put the new one on. And sometimes they're a little hard to find if they're a clear patch, or sometimes they make them in a skin tone color, kind of like these. They can be a little hard to find sometimes. So we want to be careful and make sure we're finding the old one before we put a new one on. And then make sure you write the date and time on there. And you can just use a Sharpie and write the date and time, so it can be a good visual cue for you when it's time to take that patch off. Sometimes patches are only meant to be on for 12 hours, but sometimes it can be 3 days. And so it's just a good visual cue and reminder of how long it's been there and if it's time to take it off yet. So eye medication, so eye drops and eye ointments. We want to make sure that before we get started that we kind of clean around the person's eye if they have any kind of discharge. So just using a wet washcloth and just kind of wiping their eyes a little bit to make sure they don't have a lot of discharge there. And then making sure that we keep the eyedropper clean. So we really want to avoid touching the person's eyelid or their eye with the dropper. We want to keep that as clean and sterile as possible. And that goes for the cap too. So not putting the cap in some kind of area where there could be a lot of germs or bacteria, but keeping that cap clean. And then also, if the eye drops were in the refrigerator, trying to get them to sort of room temperature before you give them. So you can usually take out the little eyedropper and kind of just rub it between your hands for a little bit, and that can warm it up some. And when you actually administer these, you just want to have them pull, you just want to pull down on their lower eyelid and have the person look up. And you don't have to pull on both lids, just the lower one, and then have them look up. And then you're going to aim kind of for this area in between the eyelid and the eyeball right there with a dropper if you're giving drops. And then if you're doing ointment, you would just kind of aim for that lower eyelid and just do a little strip of ointment there. And sometimes it can be a little hard to keep your hand steady while you're doing this. So if you are having to give these, you can always put your hand kind of rested on their forehead. So if like this was someone's forehead, I could put my hand here and rest it there, and it gives me some stability. So I'm not like shaking and moving around. And that way, when I give those drops or that ointment, I can be pretty steady with my hands, and I'm not worried about poking their eye or their eyelid or something. So it can be helpful if you just need to help steady your hand a little bit. And so ear medication, so ear drops. So again, kind of like the eye drops, you want to try and make sure there's not a lot of drainage there. So if there is, you can use a cotton ball or some tissues to kind of clean around the ear. And then you want to have the person lay on their side. And then again, like the eye drops, you want to try and make sure it's room temperature. So you want to pull out that dropper, and if it's been in the fridge, you can just rub it between your hands again to help warm it up. And we want to pull up and back when we're giving ear drops. So you would have the person lay on their side, and then you would pull up and pull back. And you grab onto this top part of the ear. So pull up and pull back, and then you would aim for the wall of their ear canal. So you're not really aiming for the eardrum, you're aiming for the wall of the ear canal. And then have that person just lay on their side for a little bit, good 5 or 10 minutes, just to help make sure that medication works its way down their ear canal. Um, and then that way we're going to make sure it's going to get absorbed. So rectal medication. So sometimes we have to give suppositories. So when we do this, of course, we want to have the person covered as much as we can to help with their dignity and comfort. And we want to try and have the person lay on their side, preferably their left side, just because that's the way the colon goes, the anatomy, it goes to the left first. So we want to try and have the person lay on their left side. And then we want to wear gloves, of course. We want to have some lubricant handy. So some kind of water-based lubricant. So KY jelly is pretty good, just something water-based. And then when we have suppositories, we want to do the tapered end first. There's a flat end and there's a tapered end. And we always want to use the taper end. And make sure we put a good amount of lubricant on there. It's kind of hard to overdo it, honestly, with the lubricant. You want to just make that as easy as possible. And then when you put in a suppository, you're going to use your index finger, usually of your dominant hand. So this is where it gets a little tricky if you're a lefty, but you would just get your index finger, and when you insert that suppository, you'll feel kind of like what we call a wink. So if you put your finger out here like this and you squeeze your finger, that's kind of what it feels like. So you'll feel that wink, and then you're going to push down, and then just making sure they stay clean and that they're comfortable. And of course, keeping in mind if that person's been having loose stools or diarrhea, that's probably not a good time to put in a suppository, because they're honestly not going to be able to keep it in. But having that person lay down for a little bit and just trying to hold that in for a good 10 or 15 minutes, as much as they can. So just keeping those things in mind. And then injections. So I'm not going to talk too much about actually administering them, but I had just a few points to make. There's a very good video that AARP made on injections that's very helpful, and they give lots of good directions there. But just to mention a few things, so there's a couple different types of injections. There's a subcutaneous and there's intramuscular. These are different kinds that you might give at home. So the subcutaneous, they go into the fat tissue. So this is something like insulin. Blood thinners can also be subcutaneous. That might be something you have to give. And they just go into the fat tissue. And then intramuscular, those go into the muscle. So these are things usually like when you get a flu shot or a pneumonia shot, they're giving it into the muscle. But sometimes if someone's on hospice, you might have to give pain medication or some anxiety medications. Sometimes those go into the muscle too. So it's just something to keep in mind. And some general kind of tips and safety things to consider with injections is to, of course, avoid infection. So making sure that we're washing our hands, that we're cleaning the injection site with an alcohol wipe. And then if there's a vial that you're going to get that medication from, that we clean the vial with an alcohol wipe. And then trying to rotate injection sites if we're giving that medication repeatedly. So if it's something like insulin, we could give it on the left side of the abdomen one day, and then on the next day we'll go to the right side, and then another day maybe we'll go on a different part of the left side of the abdomen. So just trying to rotate where we're giving those injections. And then being aware of safety. So different injections have different safety mechanisms. Sometimes the needles will retract after you give a medication. Sometimes there's a little cap that you can flip to cover the needle after you give it. So just kind of being aware of if there is a safety mechanism on there, and understanding what it is. Of course, if there isn't any kind of safety mechanism there, we don't want to try and recap a needle after we give an injection. You want to just put it in your sharps container that you have at your home. So just trying to not recap them, but being really mindful of that safety mechanism for your safety and for your loved one's safety, because you don't want to accidentally poke them when you're not meaning to, and then you don't want to inject yourself accidentally either and poke yourself. So just really being aware of that. and then keep in a sharps container. So a lot of times I've seen some people, they'll use an old laundry soap bottle, and they'll use that for their sharps container. And you'd want to make sure you label it well, that it says sharps on there, so that people know if they see it that there's not laundry soap in there, there's needles in there. But you can also use like an old coffee can, just something kind of a heavy duty plastic or metal, would work. Not something thin like a water bottle, like those, that kind of plastic's too thin. You want something heavy duty. And then just making sure we're not putting it in the regular trash. So we actually have some resources for you about how to dispose of needles, and how to get rid of those, because we have to be kind of careful with that. So just general tips. So, in summary, we talked about a lot of different things. So, we talked about oral medications and different kinds of pills and syrups. We talked about skin medications. And so, there's ointments, there's patches, different ones of those. The eye drops, the eye ointment, the different ear drops, rectal medications. So, talking about suppositories, and then some just general injection tips. So we have more resources for you from AARP. A lot of it's from AARP. They did some really wonderful videos about administering a lot of medications. So please go watch those if you have time. They're very well made videos. And then if you have any questions, please let us know. We're here. If you don't hesitate to reach out if you have questions about something. And thank you so much for listening to this.